Hi lovelies, welcome back to my channel. Today we are going to be talking about self-diagnosing with PCOS on the internet. Before I say anything, I want to acknowledge the women that are really struggling with PCOS. PCOS is real. It can be frustrating. It can affect your body, emotion, and confidence. This video is not dismissing your experience. It brings clarity and reduce fear. I want you to know you are cherished and not dismissed. If you have been diagnosed correctly with PCOS, I want you to know your experience is valid. And this video is all about education, not judgmental and not blame. At the same time, the way PCOS is being talked about on internet, most especially on TikTok, is creating lots of fear and confusion for women. And that is what I want to gently address today. Why is PCOS so misunderstood on the internet? Lately, it feels like everybody has PCOS. A missed period, PCOS. Acne, PCOS. Weight gain, PCOS. Please, let's slow down and talk calmly. PCOS stands for polycystic ovary syndrome. It is a hormonal condition, not an infection, and cannot be caught. And it is not something that should be or can be diagnosed through comment section on the internet. Even in healthcare system, PCOS can be so frustrating to diagnose. PCOS is so challenging to diagnose because it shows different symptoms in women. My point is, PCOS is diagnosed over time, not just with one or two symptoms. The internet tends to simplify complex health issues, leads to go viral, fear spreads fast, and sudden normal hormone change. Things that are often mistaken as PCOS: coming off birth control, postpartum hormones, travel and lifestyle change, thyroid imbalance, and hormonal fluctuations. I want you to know irregular menstrual cycle doesn't mean it is PCOS. This might surprise you because PCOS can be misdiagnosed, not because doctors are careless, but because there is no single test that rule out PCOS. I'll give you an example of myself years back. I remember I was having this intense lower abdominal sharp pain, and this very day I went to the hospital immediately. They did some blood works, and the blood work seems like there's nothing really happened, but because the doctor really wants to diagnose me, and the doctor diagnosed me ovary torsion. No way I have ovary torsion and I would walk on my 2 feet into this hospital. So my bottom line is, do it carefully, take your time. It is not something you can just diagnose immediately. The way PCOS is diagnosed, doctors usually look at some complex symptoms, blood test, sometimes ultrasound. And I will tell you, the doctor you need to seek is either a gynecologist or endocrinologist. The other condition can look exactly like PCOS, which is why proper assessment is required. Diagnosis is a process, not a moment. PCOS is chronic, meaning it doesn't just disappear, but manageable. Note that. At the moment, there is no permanent pills that cures PCOS. So when people online sell quick fix, it only pauses it, not cures it. If something sounds too good to be true, it's probably need a second thought. Yes. What women can do instead of self-diagnosing through the internet or through the video you watch on TikTok or anywhere: seek a proper professional assessment. See a gynecologist or endocrinologist, please. A general practitioner might be leaving something out, but when you go to the doctor that specializes in hormones and women reproduction and women organ, they would tell you exactly and how to really diagnose based on your symptoms. Always remember as well, our body is not the same thing. The symptoms I would have is different from the symptoms you would have. Also, ask questions, not from online, please. Ask question, ask your doctor question, a specialist doctor. Focus on overall health. Be patient with your body. Also, there are some things mistaken for PCOS because you did not get properly assessed. Stress and burnout. Yes, we should think about how much did we stress mentally, physically, while working, while studying, while doing anything, can delay ovulation and periods. Also can cause hormonal disorder. Stress can change your menstrual cycle. Coming off birth control, I will use myself as an example. I had implants under my arm, which I took off 2 months ago. During the use of these implants, it really messed up my hormones, my menstrual cycle, everything, my mood, everything listed as this PCOS sign is messed up my whole feminine cycle. The moment I get it removed, I'm still trying to get my hormones to come back to normal. This doesn't mean I have a PCOS because I got it properly checked. Coming off birth control can delay your hormones coming back to normal. It might take 2, 3, 4 months. In some women, it takes 6 months for their hormones to come back to normal. And all listed: weight gain, disappearing menstruation, hormonal acne. So coming off birth control can take time for your hormones to get back to normal. Please be patient with your body and don't diagnose yourself something else. Another one is postpartum hormonal change. Hormones fluctuate after giving birth or after miscarriage. Hair loss, acne, irregular cycle are very common. Doesn't automatically mean you have PCOS. Thyroid disorder. This can cause fatigue, weight gain or weight loss, affect your menstrual cycle a lot, often confused also as PCOS. Weight gain or weight loss. Rapid weight shift can affect your ovulation, yes. It's just your body adjusting to the current situation. Another one is high prolactin level, which lots thinks they have PCOS. This can stop your ovulation. It mimics all PCOS symptoms, but still you need to get the blood work and get checked properly. Poor sleep and lifestyle change. Another one is our diet. Yes, I used to tell a lot of women that our diet matters because the way we are structured is different from the way the men's are structured. Something the men would eat and get away with, we cannot always eat it and get away with it because of the way our body is wired. One thing I want women to know is sugar disrupts a lot in our body system. I would say on our diet, why don't you try intermittent fasting at least for 10 weeks and let your body rejuvenate, let your body regenerate itself, let your body correct something within itself, let your body repair, let homeostasis take place during intermittent fasting. After the 10 weeks, lots of things will be corrected. And if you're still feeling the symptoms, then you should get a doctor instead of diagnosing yourself with what you see on the internet. The last one I'll be mentioning is normal hormones fluctuation. Yes, our hormones fluctuate a lot. As a woman, our hormones fluctuate a lot. It happens when the season change. It happens from what we eat. It happens according to the stress we go through. Especially in our 20s, in our 30s, our hormones tends to fluctuate a lot. And our cycle takes time to regulate. The bottom line of what I have been saying all day is please get checked properly. See a specialist, not just general practitioner. Get checked properly and stop consuming what the internet is selling to you. What works for me might not work for you. And also, I want you to remember all these things we are consuming, even if someone did not have PCOS before and start consuming all these pills, it goes to damage some things inside us because they can't find what they are being used for. So remember to stay hydrated, eat healthy, eliminate all sorts of sugar in your diet. No sugary drink, just water, plain tea, plain coffee, no carbonated drink. If you need to consume sugar, you can consume your sugar through fruit, and not all fruit sugar are healthy. Once again, I will say PCOS is real. For the women struggling with PCOS that are well diagnosed with, keep fighting it. You've got it. You're well loved. You are ahead. And to others thinking they have it, I want you to know many conditions mimic PCOS symptoms. Education reduces fear. If you are concerned, don't panic, don't be scared. Get assessed properly. Have a nice day.